Hello everybody and welcome to the Tuesday edition of Video Clips. I hope you had a wonderful Thanksgiving and heeded my advice not to eat anything that I wouldn't eat. I'm sure you all did that and heard the voice in the back of your head saying Pam would not be happy to see me eating this particular thing at this particular point in time. Alright, so on to new things. First of all, if you're looking for holiday gifts, we have them here. Gift certificates are always welcome for any of the things that we do here, including Institute courses, and also we ship some of the nicest cookie boxes all over the world. Gingerbread biscotti, which we only make at holiday time in the kitchen. The whole building smells like gingerbread, so please buy the cookies so that I'm not tempted to eat them. And then we have other types of cookie boxes and gift boxes too, so if you're interested in healthy things to send to friends instead of the usual tchotchkes and other things that probably people don't need, give us a call. The other thing is winter semester starts mid-January. We're offering chemistry, biology, sports nutrition, dietary supplements, so if you're interested in seeing the calendar, send me an email and I'll send it to you. We also have some new certification courses and specials, so you can save lots of money if you sign up for lots of them. Sports nutrition, dietary supplements, autoimmune diseases, research and writing, igniting the curiosity gene. I've titled this particular course. If you're interested in learning how to be effective at doing research and digging up information and writing articles and helping other people with their health, this is a course that you might want to take. So lots of things going on here, including professional training and development courses. If any of these things are interesting to you, send an email to pampopper@msn.com, and if it's something that requires a conversation, I'm more than happy to talk to you about it. Alrighty? So let's go on and talk about drug reps and doctors. This is a new research study that's sort of, it's not surprising, but horrifying nonetheless. In 2012, the drug companies spent $89.5 billion on direct marketing to doctors through drug reps. And a group of researchers just analyzed data from 49 studies that were published between 1992 and 2016 that assessed the relationship between pharmaceutical sales reps, which we will refer to as PSRs, and doctors. Now, none of this is going to be a surprise to those of you who've been listening to me for a long time, but what it will do is remind you of how important it really is to be an informed consumer and for consumers to gather their own information about any treatment that involves drugs. They just can't count on objective opinions from doctors. So according to the research group, interaction with PSRs and the activities that they promote influences prescribing decisions, which is why drug companies are willing to invest so much money. In other words, they expect to get a return on investment. One of the reasons for this influence is that doctors are often unable to tell the difference between sales pieces and scientific evidence. Now, when questioned, here's what doctors say. They can tell the difference. It's the other doctors who can't. So they all place the blame on all the other doctors who are influenced, but they insist that they're not. The analysis showed that the influence of drug reps starts in medical school. Most doctors and residents have at least one interaction per month with PSRs. A PSR interaction with residents was higher at the beginning of residency, and most program directors of internal medicine residencies in the U.S. allow PSRs to meet with residents during working hours and also to sponsor conferences. Attending physicians and specialists had more PSR meetings than residents and were also given more goodies like samples and promotional materials. Private practice doctors were more likely to receive gifts than doctors employed in public sector. The most common gifts were samples, promotional material, invitations to dinners, free lunches, free journals, and continuing medical education. According to the study's authors, doctors have a positive attitude about PSRs, reporting that they're an important source of education and funding for research. Doctors generally think that free conferences and free samples are appropriate gifts. They also think that the information provided by the PSRs and industry-sponsored CME programs is very important for increasing their scientific knowledge. Doctors report that they don't think that PSRs influence their prescribing habits, and the more gifts they received, the more insistent they were that these gifts were not having any influence at all. Now, this just defies logic because the drug companies simply wouldn't provide all this stuff if they didn't get a return on their investment. Sponsored lectures and conferences led to increased prescribing by doctors who attended, even when there was no evidence at all presented showing that the drugs discussed were superior to other options. Most doctors who attended the conferences were not able to correctly identify inaccurate information about the drugs discussed. Doctors who attended CME events in particular were more likely to prescribe branded drugs, while doctors who did not attend such events were more likely to prescribe generics and cheaper drugs. Doctors hired as speakers to conduct drug-related research requested the sponsoring drug company's products be added to the formulary more often than docs who were not on the payroll. Again, not surprising. Even brief meetings with PSRs, along with receipt of honoraria or research, were predictive of requests to change the hospital formulary. Trips were really effective in increasing prescribing, although doctors again insisted that trips that were paid for by the drug companies had no influence on their behavior at all. The drug companies are smart. They focus a lot of attention on residents and interns, training future doctors not only to prescribe, but they're normalizing, this is a way of normalizing interaction with drug reps because it starts early. The residents and interns watch doctors who are supervising them, interacting with these people, so it just seems like part of the job description. The researchers concluded, surprise, it's clear that PSR interactions compromise the objectivity of physicians in making clinical decisions. The relationship of physicians with patients is of a fiduciary nature, they wrote. Hence, activities that might affect that relationship by altering physicians' clinical behavior are not acceptable. I've said for many years, at least these relationships should be fully disclosed to patients who then might be just a little bit more inclined to take a doctor's recommendations with a grain of salt. Well, while we're on the topic of drugs, let's talk about antibiotics, which is a growing concern, I think, among all health professionals. One of the top risk factors for developing a C. diff infection, which can be life-threatening, is taking antibiotics. And it used to be that C. diff was principally seen in hospital settings. I've written a couple of articles about the growing incidence of C. diff in community settings, which should frighten us all. There are a lot of reasons for this, and as it turns out, a new research group doing a study reports that one of the reasons for it is the prescribing habits of dentists, something else I've written quite a bit about. Stacy Holzbauer, she has a master's degree in public health, and her colleagues interviewed 1,626 Minnesota residents diagnosed with community-acquired C. diff. Of those, 57% reported being prescribed an antibiotic during the 12 weeks prior to infection, and 15% had been given a prescription by a dentist. The most commonly prescribed antibiotic prescribed by dentists was clindamycin, which causes diarrhea, and also is one of the antibiotics most associated with increased risk of C. diff. Most important, only 34% of the patients who were prescribed an antibiotic by a dentist had a note about the prescription in their medical chart, which means that doctors aren't asking about antibiotics prescribed by dentists. It makes this data make it clear that dentists aren't really warning patients about the risks of taking antibiotics, and so we have incomplete records and inappropriate prescribing, both of those going on. Holzhauer says, I think the biggest issue is that dentists have been left out of the conversation because nobody really realized how large the dental prescribing was in the general scheme of things, especially when it comes to outpatient prescribing. She says that medical professionals have been told for 20 years to be more cautious about prescribing, but that, quote, dentists are at the place primary care physicians were 20 years ago. And this is true. You know how hard I am on doctors, but I have to give the medical profession credit for really reducing the number of antibiotic prescriptions, while the dentists just seem to have gone off the rails on this issue. Dentists issued 24% of prescriptions for antibiotics in 2013, about 10% of the antibiotics that were prescribed on an outpatient basis. According to Holzbauer, it's likely that dentists aren't adhering to current prescribing guidelines. For example, American Dental Association guidelines currently recommend against prophylactic antibiotics for people who have joint implants or stents, but many patients are still advised to take antibiotics even before they're getting their teeth cleaned. And by the way, the ADA's recommendations in many ways are not being followed by dentists, and that includes the frequency of dental x-rays, another topic I've written and spoken about quite a bit. Antibiotics are also prescribed after procedures to prevent infection, even though prophylactic prescribing is no longer considered appropriate. While most health professionals, as I mentioned, are making an effort to reduce prescriptions, the dentists seem to be showing a propensity to increase their prescribing over time. It's also well documented that healthcare practices are really slow to change, and even in the face of overwhelming evidence. So I don't think we can look for this to go away anytime soon. So I think that consumers have to be more educated. That's like my continuing mantra. But when an antibiotic is prescribed, the consumer has got to start taking a little bit of responsibility. And so the first thing is to always decline prophylactic antibiotics. I mean, I've always advised against taking drugs or having procedures for conditions that are non-existent. So if you don't have an infection, you're not a candidate for an antibiotic most of the time. Patients should also ask this question: what is the likelihood of the infection I have going away on its own? I don't think that's true with C-diff. It probably requires treatment, but we have good research showing that, for example, childhood ear infections almost always resolve on their own, and an antibiotic is not necessary. Another question that patients should ask: is there another alternative that might help me resolve this infection? There are numbers of good plant antimicrobials that we've recommended here in the office for a long time, and there's no problem with antibiotic resistance with those. So I think the bottom line is, if we're going to reduce the incidence of infection with antibiotic-resistant superbugs like C. diff and MRSA, and we're going to preserve the ability to prescribe antibiotics for people who really do have life-threatening infections, we have to have a partnership between consumers and health professionals in taking responsibility for that. And one thing I will concede in terms of some of the overprescribing going on is that this is sometimes in response to consumers showing up in a doctor's office and adamantly demanding antibiotics, and when they're not given, getting hostile about it. So consumers need to get off the ledge a little bit. Dentists definitely need to get on board a lot with what the guidelines say about antibiotic prescribing. And if we can get everybody to do this, perhaps we can preserve the use of antibiotics when they really do and can save lives. All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.